So today I'll be introducing Dr. Lynn Paxton. Yeah, I see that you're already unmuted, so perfect. So hello, my name is Tina Dong, and I'm a junior at Northview High School. I'm a member of the Student Leadership Johns Creek class of 2021 and was on last year's Secretary of State Ambassador team and was gladly invited to serve as the mentor this year. It's my honor to introduce to you today Dr. Lynn Paxton. She earned her medical degree at the University of California, San Francisco, and her Master of Public Health degree at the University of California, Berkeley, and she started her formal education with her undergrad work at Princeton University. Dr. Paxton is a retired United States Public Health Service captain and has had an extensive career with the Centers for Disease Control and Prevention. She has been an international leader in HIV prevention, and after serving as the Zika coordinator for the CDC Center for Global Health, Dr. Paxton came to the Fulton County as our Department of Health District Health Director to lead Fulton County through COVID-19. Dr. Paxton, thank you so much for joining us today. And as we all know, with the pandemic, it's influenced us significantly. It's been a pretty contentious issue globally, and we're all very interested in your thoughts and your work. So let's start off with a pretty general question. Where do you think Fulton County is today regarding the virus?
Well, I think that we're doing actually, the entire United States is not going in the right direction. I think any of you who've been reading the newspapers, we'll see that. But Fulton County is also, our case rates are rising, our death rates are starting to rise, but we're putting an enormous amount of effort, into this, and I think that we're not doing as badly as some other parts of the country are doing. I think that's really kind of important. And if I may, I'll just this morning as I do with every morning, I check and see what's on my list, things to do today, and I was reminded that there was this event going on. I thought that's great, and I read again what they had wanted me to talk about, and part of it was what are my current duties and how what was my path to getting here. So I got my cup of coffee and I wrote down a couple of points just so that I would remember what to say, and I think that was good for me because I'm the district health director for Fulton County. You've heard a lot about, particularly from Commissioner Hausman, about what Fulton County does, and we're the largest single health district in Georgia. We've got over 1 million residents. And at the moment, you hear about the Board of Health mainly because of COVID. That's kind of standard for public health emergencies. You go for years and years and years, nobody thinks about the public health. Then something happens and boom, it's like, you're all over the news, and that's sort of what this has been for us. But I just want to remind everybody that the Board of Health is got a lot more going on than just COVID. And, we are the lead agency in Fulton County dealing with the COVID-19 crisis, but we do so much more than that. We have about 360 full-time employees, and now we've got many temporary employees as well to help us cover the COVID activities. We've got 8 health centers throughout the county. We also run the Vital Records Office, and that's the place where you have to go whenever you need a birth certificate or you need a death certificate. We also have the Environmental Services, which is in charge of inspecting restaurants and other public places such as hotels and community pools to make sure that they're following, all the rules and regulations. And they also do things like those mosquito surveys to monitor for diseases, such as West Nile virus. And in those 8 health centers, we provide a lot of services like HIV and TB care. We do family planning and sexual health services, immunizations, maternal and child health services, breast and cervical cancer screening, oral health services, and a lot of health promotion. So I just want to say that, the health department isn't only COVID. It's also, a whole lot more than that. And I'm sure that in the question section, I'm happy to answer lots of questions that you probably have about COVID. But to go to the second part of today's remit was, my path to career in public health and government. So this morning over my coffee, as I'm thinking about it, I realized that, my path to a career in public health and government actually started about 80 years ago in a place that I've never even seen. And, my mother was born in 1931 in Raleigh, North Carolina, which at that time was deeply segregated. And one day when she was just still really a young kid, her mother took her for a dental appointment. And even a half a century after that dental appointment, when she was talking about this to me, I could still hear in her voice the same surprise that she felt back then when she saw that the dentist was a woman. And she told me that it was at that moment that it was the first time that even occurred to her that a little Black girl like her could possibly grow up to be a dentist too. So eventually, she put herself through Howard University, and she met my father at the dental school, where she was still only one of 2 female dental students that year. So they got married. My parents worked hard to make things easier for me and my brother and sister, but all the time, belonging to lots of service organizations. And they, of course, made sure that we did our part too. And that paid off. I went off to Princeton. My sister went off to Harvard. I went off to go to medical school. After taking a year, I won a Rotary Foundation scholarships. I went off to Brazil and worked in some the slums there, actually doing family planning, and came back to medical school. Medical school, went back to Brazil, went off to France. I had the travel bug way early. And then I came to CDC. We are lucky to be here in Atlanta, because if you want to be in public health, there is no better place in the world to be than Atlanta. So I went off to CDC, did 2 years in their intensive public health program, training program. Then went off to Uganda for 4 years and worked there leading an HIV project, got wooed back to CDC, essentially never left, and did things like, go off to Tanzania for 4 years and was the President's Malaria Initiative person, was heavily involved in HIV and vaccine trials and all that sort of stuff. It was really a super fulfilling career. And then, in April of 2018, I said, that's it. I was a captain in the U.S. Public Health Service, and I was able to retire, so I retired. And I had a wonderful retirement. I was enjoying it. I'm a scuba diver, and I was going around the world scuba diving, taking my daughter, who was also a senior in high school. So, I was having a really great retirement, and then COVID hit. And then, just like everybody else in this room, I found myself confined to home, because no more traveling, no more doing this or that. But, in addition, rather than after catching up on my Netflix, I realized that I really felt like I could be doing more. And I, wanted to volunteer someplace. And then I got the call from the Commissioner of Public Health to entice me back into full-time work. And so that's how I ended up, here at the Department of Health. So, that's sort of a brief recap of my career and why I came out of retirement. But, I do have a couple of other thoughts that, sort of final thoughts as I was, thinking about this earlier today. And it made me think, going over this, without a doubt, that woman dentist back in the 1930s had no idea that her taking care of that one little Black girl that one day would end up influencing a whole family's future. And, I have one final story about my mother. Her last day on earth was January 20th, 2009. And she and my father spent the day looking at President Obama's inauguration and talking about how much the United States had changed in their lifetimes, beyond what they ever would have believed possible when they were children. And they then both went to take a nap. My father woke up, but my mother did not. And I'm happy that that's the way that her life ended, peacefully, and after witnessing such a momentous event. And after my father died, I started an annual scholarship fund in both their names. And currently there are 3 young women who've been awarded the Lawrence and Gertrude Paxton Memorial Scholarship. And it's always, really one of the highlights of my year to meet these great young women and to know that the legacy of my parents is having an ongoing influence in their lives. And I know that many, if probably not all of you, are asking, why is this woman spending so much time talking about the influence that a random encounter decades ago had on her family? And the reason is that we are currently living in momentous times where prior barriers are being surpassed every day. For example, we're now only a little over 2 months away from having the first female vice president of the United States, who also happens to be a woman of color. And you are all here today because someone has identified that you have a spark within you that should be supported. And I just want to remind you all, that we all stand on the shoulders of those who came before us, and that we need to continue to support each other. And while my personal mission in life has always been to do whatever I could to save lives and stamp out disease, I think that Arthur Ashe, who I hope you've heard about, he was a great tennis player and a humanitarian. I think he expressed it much better when he said, to achieve greatness, start where you are, use what you have, do whatever you can to assist those in need. So I've always thought those are some fabulous words. And so I just want to thank y'all for listening to me, and I just to wish you all the very best in all your endeavors, because I know you're all going to do well.
Thank you so much. That was really an inspirational story. Like, it's really a good reminder that we have to look back to the people who have helped us and assisted us and made me who we are today. So you mentioned a little bit that you thought that the nation is not really going on a good track with our handling of the coronavirus. And I know you probably don't want to talk about this as much, but given the current climate, what do you think are some like modifications or some steps that we should take as a county and as a nation to fight back this pandemic?
Yeah, well, I think that as a nation, we should go back there. Having worked at CDC a long time, I knew there was a pandemic plan that was there, but was not followed. And I think that going back to things like that are useful. Like, for example, having, the federal government taking a larger role in making testing universally available, to have a larger role in making personal protective equipment available. At the moment, it was all thrown onto the states. And so it's sort of like what I think of in my mind, it's turned into a cage match. It's the states and the counties fighting to get all of these things. And it shouldn't be that way. We have a much better role for that, for like the federal government to, to make these things available. That said, I'm lucky that, here in Fulton County, the Fulton County government has taken COVID very seriously. And so they have made money available for us to do this. So we're doing relatively well, particularly compared to many other counties, throughout, Georgia and throughout the rest of the United States. But I just don't think it should ever have been that way. That that it became such a piecemeal, patchwork approach.
Yeah, and we do have like a couple of minutes left. So just one last question. Just like District Attorney Funny Willies, do you have any advice, especially as a woman and an African woman who's pursuing this career, to any advice to students here today who are potentially also interested in the medical path in this such tumultuous time?
Mm-hmm. Well, you have to really want it. Because people come to me often. I'm surprised the number of people will come and say, well, doctors make a lot of money, so I think I'll go and look into that. And I says, haha, I will laugh at that time, because if you really want to make money fast, you don't take medicine, because you have to have a certain amount of commitment to go through the 4 years of college, of course, but then the 4 years of medical school, then the training, the 90, 100-hour work week. So you have to kind of want it. But I have to also point out to people, it's all not like TV shows like ERs. There are so many things that you can do within medicine. Like, for example, you can have my kind of a career. I had the travel bug, and I wanted to travel, and I wanted to work in developing countries. And I could do that in this, in this kind of a work. And in fact, I don't take care of as many patients now. In fact, I haven't taken care of a patient in like about 2 or 3 years, because I'm devoted to public health. But if you want to go into medicine, you can do everything from laboratory bench work, you never come out of the lab, to like, somebody like me traipsing around fields, collecting mosquitoes, in Africa. So there's a wide gamut of things that you can do. So I would advise to do a little research, if you hear somebody who's doing something you think you're interested in, call them up. Most of us, like me, talk too much. And so we are happy to talk about our experiences. And so I would say look around and sort of explore. And and you don't have to make a decision tomorrow. You have time to make these sorts of decisions.
Okay, that's actually perfectly on time. Thank you so much for coming today. I really enjoyed, all the valuable stories that you talked about. And I've listened to quite a lot of speakers today, and it's just really inspiring to see so many of you guys have a lot of trust in our generation and are really trying to help and assist us and make this world a better place. So thank you very much. And feel free to stay around for the other speakers. And you can, mute yourself again or turn off your camera.
Thanks. I also have to flip off into another. I think I'm going to be on the same elections call that Mr. Housing might be on.
Dr. Paxton, I did want to mention that. Do you know Sonia Rasmussen?
I'm sorry, what?
Do you know Sonia Rasmussen?
Oh, that name is familiar to me. Yeah,
She worked at the CDC. Now she's at the University of Florida. Anyway, she's spoken to the kids before, and I figured that you might have known her.
Yeah, I definitely know that name. I definitely do.
Yeah. Well, we really appreciate it. The kids learned so much from you, and I'm going to call on you again. I promise.
Okay, thanks. I'm going to go off to my other call. Thank you very much.
Thank you so much.